Nicky Wagner.
Mr Speaker, I rise to support this first reading of the New Zealand Public Health and Disability Amendment Bill. There is no doubt that the provision of more than just adequate public health and disability services to the people of New Zealand is one of the biggest challenges in our country now and in the future. New Zealanders expect that living in a first world country, they should have access to the very best cutting-edge health services available. But as our population ages and as our economy struggles in comparison to other nations, this is a real economic challenge. We all want a champagne health service on a bare income. But this is not new in New Zealand, and I take inspiration from Ernest Rutherford's quote that we don't have the money, so we have to think. Back in the early 20th century at Canterbury University, when Rutherford was working on splitting the atom, he had funding challenges, but he used his money intelligently and well and finished up with a Nobel Prize for his work. New Zealand's health service faces similar funding challenges today. The government's responsibility is to use the funding we have in the most efficient and effective manner. And this bill introduced today is a drive for better value for money out of our public health sector, with the intention of providing a framework to foster economies of scale through national and regional cooperation in the sector and to reduce duplication and bureaucracy. Just like Ernest Rutherford, we don't have the money, so we have to think, and I would add, nearly 100 years later, we have to think smarter. New Zealanders want and need more for their money out of the health system, but we definitely do not want to sacrifice quality. And that's a tough call. But fortunately, it is not always impossible. Different groups within the health system are working hard to find ways to simplify processes, to reconfigure premises, and to work in different ways to improve both efficiency and effectiveness. And there are situations where we can maintain quality but spend less money doing it. And sometimes, if organisations are particularly creative, they can even find new ways to improve services that still cost less. As a member of the Health Select Committee, we have seen a number of examples of where DHBs have managed to improve their services without additional cost. In my hometown of Christchurch, we have seen how the Canterbury District Health Board focuses on the patient's journey and how that's meant that patients can move through the system quicker and therefore at less cost and often with better health outcomes. Canterbury District Health Board's emphasis on better, sooner and more convenient health care is showing real benefits for my community. The bill will provide for a range of amendments to the way that administrators run the health system, and I can see particular benefits in the amendments that support the provisions of shared administrative, supportive and procurement services. It's just a matter of economy of scale. New Zealand is a small country and our health system is particularly fragmented. To provide goods and services to a multitude of small organisations is enormously costly. So you can be sure that right now DHBs will be paying top dollar for their products and their delivery. Organisations that work closely together to share the overhead costs of procurement and supply chain will cut costs. And if they can collaborate over efficiency measures such as integrated IT systems, they'll be certainly able to stretch our health dollar further. I support this bill. It is a good step forward in providing a framework to help New Zealand bridge the gap between our expectations of healthcare and the dollars that we need to provide it.
I call Lynn Pillay.